That's a very common question that I get, and it's not so much as what happens on the way to the hospital. It's more so based on why is the ambulance still in the driveway and not going to the hospital? And I'll address that why is the ambulance still in the driveway, not going to the hospital? Our folks are highly trained, and they can do a lot of those steps in patient care that the hospital needs before the patient arrives. So oftentimes in the back of the ambulance, we're starting IVs, we're giving medication, we're taking care of wounds. We're just doing those things that are going to help provide the best possible outcome prior to leaving for the hospital. So when we do arrive at the hospital, our patient is ready to go. They have an IV established if needed. They have those basic steps done. So when we hand off patient care, they're that much further along that care process and speeds up everything. So we're doing things that have to take place, and oftentimes some of those steps, for instance, like a EKG or a 12 lead with our heart monitor, we have to do those things typically before we start driving down the road, because that roughness or bumpiness in the back of the ambulance will cause some artifact, which will indicate a funny heart rhythm. So we try and do those in a pretty safe, smooth environment, and the best and safest place typically is in back of the ambulance parked in the driveway or on the street. And those are the kind of things that we will send them to the hospital electronically, and a cardiologist or nurse will look at those heart rhythms, and if they see something that we're seeing in the field, they will activate a cardiac team. So when we arrive, those heart specialists in this example are ready to go. They know what's going on, and it speeds up that whole care process.